Hello, everybody, and welcome back to the Nutritional Revolution podcast. We have a superstar researcher here for you guys today, right out of Australia. It's 9 a.m. for her. Thank goodness. I saw her sipping her coffee. We have Dr. Alannah McKay. She completed her Bachelor of Science at the University of Western Australia and then subsequently completed her postgrad position with the physio department at the Australian Institute of Sport. And she helped with the preparation of many Australian athletes leading into the 2016 Rio Olympic Games. And then more recently has submitted her PhD titled The Effect of Dietary Manipulation on Iron Metabolism and the Immune System in Elite Athletes. So definitely something we want to dive into. And she partnered up with the Australian Institute of Sport with that publication. And then I know she has some upcoming publications coming out as well soon that we might dive into today as well. I know there's probably so much more background and publications we could list off here, but thank you so much, Alannah, for joining us.
No, thank you for having me.
Amazing. So as our listeners know, and Alannah was briefed, we will dive straight into our two truths and a lie before you guys get to learn too much about her. So go ahead and break it down for us.
Okay, so first one, I was born in the Australian Kimberley, which is a remote part of Northern Australia.
Okay.
I trained as a full-time ballet dancer for many years in my adolescence.
Okay.
And I was in a TV commercial when I was 7 years old.
Ooh, okay. Interesting. Okay, I feel like it's not impossible for you to be born in the northern, what it was called, Kimber, was it Kimber?
The Kimberley.
Kimberley.
Yeah.
Trained as a ballet dancer.
I feel like the ballet could be true. So
I think, yeah, I'm going to go with you were not in a TV commercial, but don't tell us the answer. What do you think, Lexi?
I think that was also the same. Not
Okay.
a TV commercial. I can see her being a dancer.
Yeah. I definitely can
point.
see you being a dancer for sure. Okay. We'll reveal the answer to the listeners at the end, but why don't we dive into, and we might reveal some of these lies or truths as we go here, but as we learn more about you, what got you so excited about researching athletes and iron?
Yeah, I did a sports science degree when I came out of school, and I really kind of did it because I thought it would be a really fun degree. I didn't really have any ambitions of doing anything much further than having a fun couple of years in university. And I just realized that the human body and movement and physiology really just took my interest. And I was really lucky when I finished my undergrad to find a place at the Australian Institute of Sport. And that was just the best environment, where I was around all these sports scientists and dietitians and high-level athletes, and I just fell in love with it. So that's really what sparked my interest. And then I started doing my honours year, which is kind of like a smaller master's year in Australia. And I met Pete Peeling during that process. And at the time, I was doing much more immunological work with another supervisor, but his specialty was iron, and he kind of guided me into the iron world, and have been completely fascinated by it ever since.
I agree. I'm super excited to talk to you, if you can tell. Okay, so I think we'll break down some of the simple stuff for our listeners, kind of just starting off with, what is iron?
Yeah, so iron is a mineral, and it can't be produced by the body. So what that means is that we need to get it exogenously, which is typically through food or through supplements. So that's the only way we can attain iron. And that iron has really important processes in the body. So the main and probably the most functional one is the production of red blood cells. So if we think of iron being heme is another word for iron, and we have hemoglobin, that is mostly iron. So it's important when we're looking at oxygen traveling around the body that we have sufficient hemoglobin and iron to make the hemoglobin. And that's particularly important for athletes that are performing endurance type sports, where VO2 max is really important. But iron also has a bunch of other functions. It's really important in energy metabolism, so actually the production of ATP and making you metabolically efficient. And it also has known roles in neurological and immunological functioning, so keeping you healthy and being sure you can make adequate decisions and aren't tired.
I might need some iron. So if someone's listening to it and having the exact same reaction as myself, should they go out and grab an iron supplement, or should they talk to their doctor?
I definitely think you should talk to your doctor. There's a lot of symptoms of iron deficiency that can be more generic. So the biggest one of iron deficiency and even iron overload is just a fatigue or a tiredness and lethargic. But that can be caused by so many other things in our lifestyle. So I think sometimes people might jump to conclusions around iron deficiency before being tested. So it's really important you go to your doctor and you get screened for iron deficiency before you start supplementing.
Yeah. And what kind of markers should someone ask for or look for on their past labs for iron? Because I know there are a lot of iron related lab markers.
Yeah, there is definitely a few markers you can look for. Probably the most important two that I like to look at is serum ferritin. So ferritin is the iron storage protein, and it essentially is telling you how much iron you have in storage ready to be used. And when we see ferritin start to drop off and get quite low, we know that there's not a lot in reserve if the body needs it. So ferritin's a really good one. And the second one would be hemoglobin. So as I'd mentioned before, it's actually the amount of iron and red blood cells you have. And when hemoglobin starts to fall and drop to a level that's we deem insufficient, we're likely to see endurance performance be impaired because of that. So ferritin and hemoglobin are the two most basic markers you should look for. But there's a bunch of other markers that can be used to help with the diagnosis, such as serum iron, transferrin, and a few other ones. But I'd say ferritin and hemoglobin are the two you really want to look out for.
So if someone's ferritin is low, like sub 10, but their hemoglobin is normal, what would you think of that?
I would think that it's only a matter of time before the hemoglobin production starts to be impaired. So we often see that we have different stages of iron deficiency. The first stage of iron deficiency, we think of as ferritin that's less than about 35. And this is more a warning that the body is starting to get into low storage. And this is when you can start to look at food choices to try and increase your iron intake. Once we get below 20 in ferritin, we now know that we're very severely low on iron, and we may look at supplementation and other mechanisms. But we say less than 12 is probably when hemoglobin is probably going to be impaired. And it actually doesn't, it gets to that lower point before we do see the impairment in hemoglobin. And that's why it's really important that we screen at those higher stages of iron deficiency to really pick up any iron deficiency before it impacts the hemoglobin concentrations. And when we get to those sort of low levels, you can even look at things like an iron infusion to bring those levels back up, particularly in athletes, because we know athletes need hemoglobin, and they're going to be training a lot as well, where they need to have adequate levels of iron. So, yeah.
Awesome. That kind of dives me into a little bit of my next question, which is what kind of things might suppress one's iron levels or ferritin levels? We can say that too.
Yeah. So if we think of exercise in itself is probably the biggest factor. So we have a couple of ways that exercise can impact iron. The first one is exercise in high volume is going to cause lots of sweating. It's also going to cause, and in sweat we lose iron. We also lose iron in urine and through gastrointestinal bleeding, which are often really common parts of exercise. We just do see gastrointestinal bleeding in small amounts occur. And also hemolysis, which is a foot strike action where we see iron, essentially the red blood cell bursts and the iron spilled from the red cell. So they're the direct means of iron loss that occur through exercise, and it probably is very small, but it is enough that could put athletes at higher risk of iron deficiency. On the other side, we also have exercise causes a spike in inflammation, and that causes an increase in the iron regulatory hormone hepcidin. And so what we know with exercise, and particularly people that are performing maybe multiple bouts of exercise a day, is that when this spike in the iron regulatory hormone hepcidin occurs, we do see a reduction in iron absorption. So you could be eating all the iron in the world, but if you're eating it when this hormone's elevated, you're probably not going to absorb as much of it as you should. And that in itself can cause you to be at increased risk of iron deficiency as well. And then finally, you know, it's one of the ones that we can't avoid, and it's why we see so many females that have iron deficiency, but the menstrual cycle and both fluctuations in estrogen as well as direct blood loss during athletes having their period, that does put an athlete at risk of iron deficiency as well. So generally females are a high risk group for iron deficiency, but female athletes are an even higher risk group because of the exercise factors as well. So they're probably the main things that we see that probably contribute to an iron deficiency in this cohort.
So fascinating. I have so many questions already. So, first one being hepcidin, or you call it hepcidin. Is that how you pronounce it?
That might be my Australian accent that does that.
I'll go with it. I'll go with it. Is that something that is like highest immediately after exercise, or is it slowly tapering up post-exercise?
Yeah, we see it start to crawl up about 1 hour post-exercise, and it peaks anywhere between 3 to 6 hours post-exercise.
Okay.
We also know that it's lowest in the morning. So there's a diurnal rhythm to it as well. So it's lowest in the morning and highest in the evening. And then on top of that, it will peak around 3 to 6 hours post an exercise bout.
Interesting. Okay. That I have so many questions for you. We have our bullets that I'm supposed to follow, but all these are bringing up questions. My other question was kind of that third factor that you mentioned, menstruation, estrogen, et cetera. Have you seen any correlation between whether it's like HRT, or will any exogenous hormone supplementation affect hepcidin or iron absorption, out of curiosity?
Yeah, I think probably the biggest one is we know if you're on the oral contraceptive pill that you will probably have reduced menstrual bleeding, and it can be used actually to treat menstrual pain or heavy menstrual bleeding being non-contraceptive, and that in itself can reduce the amount of blood loss that's going to occur in there for iron loss. So it can actually be helpful when managing severe iron deficiency when it's been instigated through heavy menstrual bleeding. But in terms of directly impacting iron absorption, not so much that I've seen.
Okay.
Not so much that I've seen.
Okay. And if someone were supplementing with iron, you mentioned the hepcidin elevation and or like low points of the day, would it be optimal for them to take it immediately post-exercise, obviously, versus 3 hours post-exercise or pre-exercise?
Yeah. So this is like a really interesting area that we've been looking at as a group more recently in the last few years. And as I said, hepcidin will peak about 3 hours post-exercise. So that's going to be when iron absorption is at its lowest. And there's been a great paper published probably in the last 6 months by a group in the US who showed that when iron was ingested 2 hours post-exercise, that it was impaired by about 36%, I think it was.
Wow.
So it's quite a large impairment when it's taken about 2 hours post-exercise and beyond. On that front, Rachel McCormick, who actually works at Australian Catholic University with us now, but we also did our PhDs together back in Perth. She published a study during her PhD which looked at iron taken 30 minutes post-exercise. And what she found was that if you get your iron in immediately post-exercise before that rise in hepcidin, there's actually we don't really know the mechanism, but there's something about exercise that seems to prime the gut to allow more iron to be absorbed.
Interesting.
So if you get your exercise in immediately post-exercise, that's a really good strategy. But if you're a bit late, it's not worth it because you're about to move into that period where hepcidin is going to be elevated.
Right.
And then most recently, we've just completed a study, and this is one of the ones that is about, hopefully will be published very soon, but we actually showed that if you take your iron immediately before exercise, so in the morning, you're going to have a similar amount of iron absorbed compared to if you take it 30 minutes post-exercise. So getting it in before exercise or up to 30 minutes post-exercise is probably your optimal window.
Okay.
And if you're using pre-exercise supplementation, it actually gives you some other options, because if we think of things like training fasted and training low, which are common practices in nutrition for endurance athletes, if you're taking your iron fasted, you're probably going to absorb about 50% more. So you can really get bang for your buck by taking an iron supplement pre-exercise, assuming that you're not having any side effects, which can be common. But pre-exercise, you can implement some other strategies around nutrition to get the most out of your supplement, and up to 30 minutes post-exercise.
Interesting. Very interesting. And how do things like coffee and maybe like calcium supplements and stuff like that impact iron absorption or iron supplementation and absorption?
Yeah, this is probably the question I get the most out of, because with so many endurance athletes requiring supplementation and potentially being on the verge of deficient, and most endurance athletes also drinking a lot of coffee, it's one I get a lot. But we know that it's not so much the caffeine, but it's the polyphenols and the tannins in coffee and tea that can inhibit iron absorption. So it can be detrimental to iron absorption. And similar to calcium, calcium also can be inhibitory to iron absorption. So we don't recommend, theoretically, that you take your iron supplement with those factors. But in practice, that's really difficult, because if you're having a morning coffee or you're having a bowl of cereal before or immediately after you run, which is, really good sports nutrition practice in general, and you're taking your iron, it becomes very difficult to navigate how you get around that. So I really say that you need to work with a sports dietitian or talk to somebody that knows about all the factors of nutrition, because I don't want you to take your iron supplement to get the best absorption, but then maybe you're not getting the training benefits from the caffeine that you might want to take pre-exercise, or you're not getting the post-exercise protein ingestion because you're compromising your food intake. So as much as it's theoretically sound to take your iron supplement and avoid if possible, any food for 2 hours afterwards, but particularly calcium and coffees and teas, it's practically not always available. And more iron is more iron. So even if you're going to have a slight reduction in the absorption, I'd rather you take the iron, maybe 30 minutes after your coffee, and still get some of the iron. I think some people think, I want a coffee today, so I'm just not going to take an iron supplement. But you're just going to have some sort of impairment on absorption. It's still worthwhile doing it, though.
Yeah. Okay. And are there certain forms of iron that are more maybe bioavailable or easier on the gut than others that people should look for?
Yeah, if we're looking at, I guess if we talk about food first, we have two sorts of iron. We have heme iron, which is animal-based products. So we're thinking red meats, chickens, fishes, those sort of things. And then we have non-heme iron, which is plant-based products. So thinking green leafy vegetables, and also iron that's found in grainy foods and cereals, because it's in Australia anyway. I'm not sure about other places in the world, but a lot of our cereals are fortified with iron. So if you're going to have your Wheat Bix in the morning, you're also going to get a large chunk of iron because it's all fortified with non-heme iron. But in that context, we do know that heme iron or animal-based products do result in higher absorption compared to non-heme iron. And it can be the reason why some vegetarians can be at higher risk of iron deficiency, because they're only eating non-heme iron sources. And I would never say that you can't be vegetarian and have healthy iron. Those two things can absolutely exist, but you do need to think about when you're eating your non-heme iron sources and potentially eating slightly more so you have the same amount of iron that actually gets absorbed. So that's on the food front. But then we think about supplements. Most supplements are non-heme sources. So they're things like iron salts or different formulations that are coming out. We've seen some things with the intrinsic coating, so they're slow release and they can be nicer on the gut. But I would say iron salts are particularly popular simply because they're cheap, and cheap is good, and they are effective. They also work. So the iron salts are probably the ones we see and recommend the most.
And is that what you see the majority of the literature looking at as well, utilizing iron salts?
Yeah, things that are looking at iron supplementation and efficacy around protocols, timing, doses, they usually use iron salts. There is a bit of literature now looking at some of these different formulations, and when we do look at those, they're normally compared to an iron salt because they are effective, easy mean. The only thing I would say with the iron salts is that they can be tolerated poorly in some athletes, just because it's a large amount of iron that's hitting the gut, and the gut doesn't always like that. So particularly in athletes who maybe are running a lot or cycling a lot, it can be a bit hard to tolerate. So moving to some other formulations can be beneficial in that sense. But I would say iron salts are probably your first stop to try, simply because of price point and availability.
Yeah. Awesome. And would the dose that someone be needing to take from a supplement, if supplement was suggested, is that dependent on where their ferritin levels were at?
Yeah, to a degree. So I think when we talk about iron supplements, we generally say a dosing is somewhere between 60 milligrams and 200 milligrams. And it definitely depends on what you're trying to achieve. So sometimes there are instances where we will recommend supplements because maybe somebody's a vegetarian and they just need a little bit of help with their iron once or twice a week. And they can take a small dose iron supplement just to give them that little bit of extra help. But then there's times where we're actually trying to correct a deficiency. So if you're trying to correct a deficiency, you do need to give larger doses and you need to give them more frequently. But it's about, I guess, when you sort of think about how you actually work with an athlete individually, it's about balancing the dose you're giving with the frequency of ingestion. When it comes to correcting a deficiency and absorption, we know more iron is more iron. So if you can take 200 milligrams every day, that's great because you're probably going to replete quite fast, but that's not going to be tolerable for most people that you're going to work with. So maybe it's 100 milligrams every day, maybe it's 200 milligrams every second day. It really depends what your goal is, if it's repletion or management, and then how well you can tolerate what you're giving your athlete.
Okay. And when you say 100 milligrams or 200 milligrams, are we talking elemental iron? Because I know when you look at the nutrition facts of the label, it can be a little bit confusing maybe when someone's
that's a really good point. It's always elemental iron we're talking about when we talk about dose between 60 and 200. And I think that's where there's some really I'd say a little bit dodgy multivitamins that say, take me to treat your deficiency. And they may say they have 100 milligrams of iron in it, but they actually only have about 4 milligrams of elemental iron, and that's not helpful. So a lot of our iron supplements that have about 100 milligrams of elemental iron may have around 400 milligrams of total iron.
Wow.
You really want to look for the elemental iron when you're picking a supplement.
Okay. Yeah, that's definitely helpful. That kind of brings up one question we got from our audience, which was, do cast iron pans really work to increase iron levels?
Yeah, it's a good question because it's a funny one. And there's literature that's quite old now, but it does show that if you cook in a cast iron pan, some of the iron will be transferred into the food that you're cooking. There are probably a lot of factors that look at that, with the age of the pan. I think a lot of the studies probably use brand new pans and there's probably a bit more iron to come off them. But I would say the amount you're actually getting out of the pan is very, very small. And I would never recommend using a cast iron pan to treat an iron deficiency. I never think you're going to get enough iron out of a pan to do that. But in terms of day-to-day, potentially increasing a small amount of your iron intake, it potentially might, but not to treat an iron deficiency. Yeah.
Thank you. Thank you. And then I did want to ask too, based off of what you've maybe seen in your research, you mentioned ferritin I think you said sub 35 is when kind of that first stage. Is an endurance athlete, if they're 40, are they performing optimally, or should they have a slightly higher ferritin marker than that, do you think?
Yeah, even at stage 1 iron deficiency, we think of this as more a forewarning. So in stage 1 iron deficiency, we don't see any effect to performance. So we really don't think that there is a performance decrement.
Okay.
Somebody with a ferritin of 40 may consider themselves in that sort of stage 1 iron deficiency for general reasons of trying to maybe look at how they can improve their iron intake, but we don't think it's affecting performance. That being said, it's very easy when you're in that range to slip into a severe stage of iron deficiency quite quickly.
Yeah.
There also depends on, what there is a lot of athletes that will sit at 40 for their whole career and be absolutely fine. And that's just where they sort of sit as a set point, and that's fine. But in other scenarios, when maybe before going to altitude or something like that, we may consider 40 not being optimal. So it kind of depends where your training goals are. And if you're coming into a really heavy training block or an altitude block where iron demands are going to be higher, you may consider yourself in that lower end range. But if you're maybe just going day to day, there's a lot of people that would sit at 40 and be fine.
Yeah.
And they don't need to provoke the gut by taking supplements or anything like that because they're steady at 40.
Right. Perfect. You just brought up altitude camp, which is where we're headed. So we do have a lot of endurance athletes go to altitude camps, or teams go to altitude camps. When should someone in the lead up to an altitude camp start thinking about iron, and what should they be thinking about?
Yeah, I think I think the recommendation currently is around 4 to 6 weeks prior to an altitude camp, you should go and get a screening done. I think when we think of altitude camp, the aim of altitude exposure is to build new red blood cells.
Mm-hmm.
And you have to think of iron as the building blocks for those new red blood cells. And if you haven't got a supply of the building blocks ready before you go to altitude, you're just not going to adapt as well as you can because there's no building blocks to build the red blood cells. So it's important that you get screened for your iron status around 4 to 6 weeks before altitude, and then start supplementing if your iron suggests you may need to. So pre-camp, I would say anything under a ferritin of 50, I would be starting to supplement in the lead up to that altitude exposure.
Okay. And that would be something where they would be taking that kind of like you suggested earlier in the day or within 30 minutes post exercise.
Yeah,
Awesome.
Just a general iron salt every day or every second day even, in that morning period or pre to 30 minutes post exercise.
Awesome. So they would do that for a little bit. And then what happens once they're at altitude camp? Do they just stop the iron supplement?
No, definitely continue iron supplementing. And we actually at altitude, depending on your pre-screening result, if you were less than 50, I would say start before you get to altitude and continue all the way through to altitude.
Mm-hmm.
If you were less than probably 200, probably my suggestion, but I know some people are a little bit more conservative or a little less conservative. But if they were under 200, I would start supplementing at altitude. So if you could sitting at, say, 150, day to day, you would be more than fine. We wouldn't have any concern of your iron status. We wouldn't need to bump your stores in the lead up to altitude, but it could be beneficial for you to take an iron supplement when at altitude, just to make sure that iron availability is high, because we know the body's going to be in an accelerated rate of making new red blood cells, and we just want to make sure there's enough iron there to support that process.
Yeah. Awesome. That's super helpful. And similar timing, I would assume, of dosing while at altitude?
Yeah. Okay. Similar timing.
Awesome. I think that's super effective or helpful too. That was one of our questions we had here was the timing. And then I have some like one-off column case study situations. A friend of mine actually is postmenopausal. She probably wouldn't care if I said her name, but I'll break down the situation. Postmenopausal. She uses the sauna very regularly, does a lot of high intensity exercise, but eats all the things like very plant-based, eats a lot of plants, I should say, but also animal proteins, etc. Has had cancer twice, beat it, breast cancer. I don't think she's on any like medications now, but she's had to get IV infusions, I think like 3 times a year at this point, and she just can't figure out why her levels would keep going down. And maybe you don't know the answer, and that's totally okay, but I'd be curious. She does not have celiac. She was tested for that. So she's like, ask her outside of cancer, like if she has any thoughts. So I thought I'd throw that one in there to see if you had any thoughts on that.
Yeah, I'm not a specialist in cancer by any means, so I wouldn't really know how that may affect her iron status. But what I do know is we did I used to work in a sporting institute, and we did an audit of some of the data we had where we'd given female athletes infusions, and we wanted to see what their ferritin was at different points during the recovery from that infusion. And what we found was that we had about 20 athletes in that analysis, and some athletes were back down in low levels of iron deficiency within 3 to 6 months.
Yeah.
Others managed to hold on to their iron stores for about 2 years. So it's really individual. Sometimes it's probably got to do with training load. The other thing that we can't overlook is genetics. There are genes that are more prone to having iron deficiency compared to other types of genes. So just depending on where you've landed in life, you could be more predisposed to having iron deficiency.
Yeah.
But we do see it with athletes, and sometimes they either just don't respond to supplementation or they know they're going to have multiple infusions over the course of their career because they just can't hold on to the iron. And sometimes we also, in those instances, like send them off to have a specialist look at their gastrointestinal tract because they could be bleeding internally, small amounts, not crazy in terms of life, but in terms of holding on to iron, it can be anemia, or we may just see really poor absorption due to different issues as well. So there are follow-up specialists you can see to maybe see or eliminate some of those issues. But I do think a part of it's genetic, and I do think a part of it is also being female as well is probably another one. It's a really hard thing to overcome the iron losses that are occurring. And even though she's postmenopausal, if she's still maybe having semi-frequent periods or things like that, that is still going to have a contributing effect. So it's so multifactorial, and I don't have a concrete answer. But there's things you can explore to see maybe where the deficiency is coming from.
Totally. I've always kind of thought about her like consistent sauna use too. Does dehydration have an effect on either iron absorption or hepcidin or anything like that?
Not so much dehydration, but we do know that when you're sweating, which in a sauna you're going to sweat lots and lots and lots, there is iron that's sweated out as part of the sweat. So it is going to be a contributing factor. We do think it's quite small, so we probably don't think it's huge. When we see consistent iron deficiency, we normally are talking about bleeding because of the iron that's coming out. But sweat is definitely something that contributes to iron loss. You find all sorts of minerals lost in sweat.
Yeah, that's really helpful. I will pass it along. She will be happy I asked you. The couple other questions I had here from our listeners, and I wanted to actually clarify when you were talking about the values at training camp and when, like if one, I believe you said if someone had less than 200, were you referring to ferritin?
Ferritin, yes.
Okay. So I had a question regarding also an athlete situation. Post race, he ended up getting some lab work done, I think within maybe 5 days post race, and his iron or ferritin, one of them was like really high. It just like shot up. Can you tell us a little bit about that, or maybe why that might happen?
So the one thing that makes iron really difficult to assess is the fact that ferritin is an acute phase protein. So what that means is that if there is any inflammation in the body, ferritin is going to respond more to the inflammation than it is as a marker of iron status. And that's probably the biggest limitation with using ferritin. It's a really good marker. It's really cheap to analyze, which is what we like in terms of things that we want to screen in lots of people, but it does respond to inflammation. And that makes using it in athletes quite difficult because it can sometimes be, in this case, super elevated, which isn't reflecting iron status. So typically when we talk about, we have a paper that was published a few years ago now where we came up with a really great protocol for screening athletes for iron deficiency and some things you should think about when you're presenting for your blood test. First thing is you should always go in the morning, and you should always try to, and this isn't always the case with athletes because they train so much, you can't always find a day where they're not doing exercise, but trying to limit particularly really heavy eccentric exercise in the 24 hours before your blood test to minimize the effect on ferritin. Now, if they've done a marathon or if they've done some sort of ultra event which provokes great strain and inflammation on the body, you would think to wait probably a week before you want to go and test those ferritin levels. But that would be why that marker is skyrocketed after a heavy exercise session.
Okay. And would there be any other lab marker one would look for to know that it is inflammation related? Like, would we kind of compare that?
Yeah, C-reactive protein's one that we like to use in our lab, where when we're measuring iron status, we'll try and measure CRP as well. Okay. It's not always feasible to do so, particularly if you're going to a generic GP, they're probably not always going to think to do it because they're not expecting everybody to run marathons the day before their test or things like that. Yeah. But if particularly in research settings, or it's probably worth people noting that if you want to get a true marker of your iron status, go when you're as rested as possible. That doesn't mean you can't do a jog the day before or anything like that. It's probably quite minimal if you're accustomed to that exercise, but don't do a heavy bout, don't do a track session or do something that's going to create high eccentric load. Go in as rested as you can so that the inflammation's as low as possible and you can get a really good reading on your iron status.
Awesome. I think that's super helpful. And most of our situations we deal with end up being athletes having low ferritin, but what would one do if they had excess iron or elevated ferritin and it was sustained, not necessarily related because it was inflammatory post-race?
Yeah, iron excess is definitely something that is a common condition, and it's normally related to hemochromatosis, which is a genetic disorder which causes you to hold on to more iron. And that's why it's really important. The symptoms of iron overload are very similar to iron deficiency. And sometimes people think, oh, I'm iron deficient, I'll take supplements. But if you're iron, you have iron excess and you start taking supplements, that's not going to help your cause at all. So that's why it's really important you go to a doctor and get screened before you start supplementing firstly. But with iron overload, again, I would suggest going to the doctor, getting the screening done so you know where you're at. And potential treatments can be things like phlebotomy. So they'll essentially just pull some blood to try and get your iron stores down. Again, they do it in a very controlled way, which you need to be going to a GP to do. But these conditions are particularly apparent in maybe metabolic conditions or with hemochromatosis, which is the genetic component. So it is as common as, well, probably not as common as iron deficiency, but still very common. And that's why you should always go see a GP.
If we think about a triathlete situation with their training year, I guess at least in Northern America, particularly being, goodness, like maybe starting to ramp up their training in February, March, April, and then it could go all the way to October. How often maybe should one be monitoring, aside from, of course, leading up to training camp, maybe early on in the year, how often should they be getting lab work done and looking at their iron markers?
Yeah, and that's a good question. We've come up with a framework for this as well, and it kind of depends on your situation. So if you're an athlete that you've had enough time in the system where you don't really have iron issues, particularly if you're a male, we'd suggest that a 12-monthly screening is sufficient, just to make sure you're not iron deficient or moving in that direction. If you're maybe a newer athlete or a junior athlete coming into the system, if you're a female athlete, we suggest potentially 6 monthly screenings is your best option. And then if you're an athlete that has a history of iron deficiency, if you're somebody that's vegetarian or vegan, if you're somebody that has your dietary intake may consist around low energy availability, particularly for performance reasons, or you're manipulating your food intake in smaller volumes, we have to think about low energy availability. If you're not eating much energy, you're probably not eating much iron as well. So if you're purposefully, for one reason or another, trying to be in lower energy availability, I suggest 3 monthly screenings as well. And we suggest maybe timing those screenings maybe 4 weeks before one of your competitions that you're probably starting out at. You would hate to go through a season and be competing and then realize you're iron deficient and you could have done something about it. Right. So frequency is probably between 6 to 3 months, depending on the athlete. And then you probably just want to find the times that suit within a season, which allow you to do heavy training blocks and then probably get assessed prior to going into competition blocks. And as you mentioned just previously, altitude would then be additional screenings on top. So before going to altitude, seeing what your ferritin levels are like, if possible to get them afterwards as well. Yeah. You do expect to see a dip in your iron status after altitude, and you have to think of it as a healthy response and like an adaptive response. You've taken the iron out of the storage and put it into the red blood cells. So the iron storage or the ferritin is going to be low. And if you give it 2 to 3 weeks, it should naturally come back up. But if it hasn't, you may need to consider supplementing for longer than just at altitude. So there are a couple of things to consider, but depending on your levels of support and how often you can get screenings done, that can sort of prohibit where you're at.
Yeah. Okay. That's super helpful. And talking about the post-altitude camp situation. So we talked about leading up and during and then testing post, but should one still be potentially supplementing for a period of time post returning from altitude?
Yeah, that's a really good question. And we don't really have much data in this sense to be able to answer that properly. I do get asked that quite a bit. And I think it's a case-by-case scenario. So if you know your athlete's prone to iron deficiency, it's probably worth going for another week or 2 afterwards. Generally, we say you can stop and, the rest will sort of take care of itself. You're no longer under that high accelerated iron demand. So your body will sort of come back to a level that's normal. But we really need to do some studies where we take athletes to an altitude camp, induce that stress, and then maybe take them back to sea level, give half that group supplements for longer and take half group off and see what the differences are and what we should be prescribing, because I don't think there's enough data to give a really firm answer on that one. It's probably more instinct and knowing your athlete and where they're at.
Awesome. So fascinating. So much. I'm like so excited to see more research here. Kind of on that note, what's coming down the pipeline for you with regards to research, or if you're allowed to
Yeah,
share?
so yeah, of course. We're always happy to share what we're doing. So as I mentioned before, we've got a paper coming out very soon, hopefully, and I'll present some of that work at ACSM this year, where we had an altitude training block, and it was actually a two-part study. We actually looked at the timing of ingestion for iron supplements in the first part of the study, which is what I talked about earlier, showing that pre-exercise is equally effective as 30 minutes post-exercise. And then we also took our athletes to an altitude training camp at about 1,800 meters, and we gave them iron isotopes and tracked how much iron they were actually absorbing at altitude. And what we found was that when you're at altitude, there's a big spike in EPO, which causes a decrease in hepcidin concentration. So you actually start to absorb more iron at altitude. I like to describe it as the body's a bit thirsty. It wants to suck up the iron, so the hepcidin gets decreased. And what we saw is that resulted in about a 2.5, threefold increase in iron absorption that occurs at altitude compared to sea level. And in that paper, we look at how ferritin changes over the course of the training camp and the implications of that change in iron absorption. So that's one thing that we hopefully will see come out quite soon. And then we're actually doing a really big long-term study at the moment. We have about 60 endurance athletes, half male, half female, and we've given them traces over a 2-year period. And because of that, we're able to track iron loss independent of iron absorption over a prolonged period of time. And we're hoping to be able to give some really good recommendations for dietary iron intake for athletes going forward. So that one's still in the pipeline and probably quite far off. We're only 3/4 of the way through testing there, but it will be a really great outcome when we get to the end of that paper.
Amazing. I'm excited for these to come out. This is awesome. And so let's see, for the listeners, where can they, we should actually reveal your lie before we let them know where they can find you. So you told us you were born in an Australian area called, I believe you said Kimberley, trained as a ballet dancer or was in a TV commercial as a child, I believe. I think the TV commercial was the lie. Which one was your lie?
Yeah, it was definitely the TV commercial. I was definitely born in a remote part of Australia, which was a very cool upbringing. And I did full-time ballet as an adolescent, and
awesome.
I only finished that when I was about 18. But yeah, I definitely have never been on TV.
Okay, cool. Well, I'm glad we got that one right. We were both on the same page, Lexi and I. And then let's see, where can people find you, follow you, like read your research? I will link some of the articles we talked about today too in the show notes for the listeners if you guys want to check those out. But where can people find you?
Yeah, I think probably the best way is on Twitter. So at McKay Alannah is probably the best place to find me. But I'm always reachable by email or private message on Twitter. And, any search of Google Scholar or PubMed, you'll find our work. So, yeah.
Amazing. Awesome. Well, thank you so much for joining us. I loved it. I know our listeners will love it. So thank you again so much for your time, Alannah.
No, that's okay. Anytime. Thank you.